So I wanted to find out scientifically, how much do we have to offer to get people to sign up, but at the same time, affect the practice as minimally as possible? It's a little bit of a puzzle to figure out. How much do we have to offer to get people to sign up and yet make the pricing such that it minimizes the financial impact on the practice? So we tested we did A/B split testing, scientific A/B split testing, over 1,000 practices. We tested a 20% discount, 18%, 15, 12, 10, and 8. And Naren, here's what we learned in that research. 10% was the sweet spot. 10% was enough to encourage people to sign up, but not so much to impact the practice negatively. Now, I want to go on the record as saying, I don't like the 10% discount. Naren, I don't like it one bit, but I like it a heck of a lot better than the 45 to 50% discount that Delta is enforcing you into. It's a lot better than that. Right, Naren?
Absolutely, Gary.
Yeah. So 10% discount. I recommend that you do this as an annual fee. Some offices will offer a monthly, they'll break it down and make it monthly, but I like to do it annually for 2 reasons. Number one, they're prepaying for their hygiene.
Right.
Naren, do you think, imagine this, imagine that I owned a gym, a fitness center, a gym, and I had annual membership fees, and you paid an annual membership fee. You're probably more likely to go to the gym, right? Because you're prepaid for it.
Yes. Yes.
I mean, right?
That is theoretically correct. Yes.
As opposed to a monthly fee where you might say, well,
I can stop it now. I don't want to pay. Yeah. I don't want to go.
I didn't go last month, so I'm not going to go this month.
Right.
So I like the idea of an annual fee because they prepay for the hygiene. And when someone's prepaid for it, they're more likely to show up. And secondly, it makes it a lot easier to administer because you only have to run one charge a year.
Right.
And so
plus, they don't have to, decide whether they need it or not 12 times a year. They can just decide once a year. That's a good business decision.
Yeah. I'd much rather have the decision-making process once a year, not 12 times a year.
Right.
Absolutely. Think how cool this is for the patient. By the way, now what I'm about to say clinically, I want everyone to know, especially our hygienists that are listening. We have many hygienists that listen to the Thriving Dentist Show. I want the hygienists to know that I know what I'm about to say doesn't make sense clinically. But if the patient wants to come in Tuesday for the first hygiene appointment of the year, and they want to come in Thursday for the second one, I know that doesn't make sense clinically, but if they wanted to, guess what, Naren? Knock yourself out. Exactly. They can do that. Now, what happens if they do that with their Delta dental insurance? How's that second insurance going to be paid?
Denied. Even if they come 5 months and 29 days later, still denied. Yes.
I recommend not having any exclusions to your 10% savings. So no fine print. Think how cool this is, Naren. Just think about the benefits of it. No annual limit. Most dental insurance plans today have an annual limit. Sometimes it's still $1,000 a year. Yes. Sometimes it's $1,200. Sometimes it's $1,500. Is there an annual limit to the membership plan savings?
Zero.
None. No annual limit. They can, if they need complex dentistry, I know that complex restorative dentistry is not an everyday thing, but if the patient had a $40,000 treatment plan and they're a membership plan patient, they're going to save 10%. That's a $4,000 savings. And we can always talk about the savings when we're presenting dentistry to our membership plan patients. And here's maybe the best benefit of all. How much time are my admin team members spending submitting claims and following up with the insurance company with our membership plan?
Zero.
None. Think how cool this is. It's a great way to figuratively roll the red carpet out to people in your community who don't have insurance.